am Dr. Rakhi Sanyal, Associate Professor in Jagannath Gupta Institute of Medical Science, Kolkata, and also a Senior Consultant in AMRI Hospital, Salt Lake, Kolkata. So, today my talk will be regarding whether diabetes is really reversible or it's just a remission. So, well, we can put it in both way. One, yes, it can be reverted, and again we can say it no, it cannot be reverted, it's just a mere remission. Just like cancer, it goes into remission. And again, if we don't follow or maintain a strict routine and lifestyle modification, it can come back, it can re-revert. Now, the natural history of diabetes is very important to know before that, and it's basically start from the normal glucose level, and then we have pre-diabetes, and then we go to clinical diabetes, followed by the complications of diabetes. Now, diabetes as such is a global problem, and till 2019 data, it was about 463 million people were adult onset diabetes, and out of that 77 million people were from Kolkata, were from India. Now, we have to, it's high time we have to roll up our sleeves and we have to target it. Now, together with that, the pharmacological interventions, and we have to follow a strict lifestyle modification to achieve our target. Now, there are diabetes which can be reverted, as for example, diabetes in obese person after bariatric surgery, gestational diabetes, stress induced diabetes, drug induced diabetes, this can all be reverted. And type 2 diabetes can also be reverted, but in the type 1 diabetes it cannot be reverted, and if the complications has already set in, it cannot be reverted. So, how do we revert it? Before that, we have to know the basic pathology, that what exactly happens which gives rise to diabetes. It's just the fat content in the liver and the pancreas which can give rise to insulin desensitization and also less insulin secretion, which is very important for the pathogenesis of diabetes. And even 1 gram of fat content in the pancreas can lead to frank diabetes. So, it's basically through lifestyle modification, if we can just revert the lipogenesis or the fat content in the liver and the pancreas, we will be able to do that. Now, how? It has been seen that if we follow a very low calorie diet, it's about 800 kilocalorie diet, which can only be possible if we take about a few liquid diets. The companies are coming out with liquid diets containing measured amount of calories, say 2 to 3 such liquid diets per day, which is nearly possible. It is nearly impossible. I will not say it is not possible, but it is nearly impossible. We can revert it. Another funda is to give 10% of the total carbohydrate in content in our diet. So, now together with that, exercise. Now, we can of course achieve it if it is needed, but to maintain it with the same devotion, it's nearly impossible, because over a time the patient gets compliant and the patient thinks that no, it's okay, I have done my diabetes, I have controlled my diabetes, no problem, let me come back to my old routine, let me come back to my old diet, and then they start taking the normal usual course, and with time again the re-reversal of the diabetes occurs. There is fat content in the liver, there is fat content in the pancreas, and which will lead to the re-reversal of the phenomena. Now basically, so it is basically the remission which is important, and ADA has pointed out it very nicely that it is the remission and it is not the reversal of diabetes which has to be taken into consideration as we go for the cancer. It is the remission and it is not the total cure of the cancer. So diabetes is like that only. It's if we are very stringent, we can achieve reversal, and if we can maintain it, then we can continue having the reversal, but if we are not stringent enough, it will revert back again, reversal of diabetes. So, it is merely basically remission is the key word. So, here I end my topic. Thank you so much.